Okay, so let's start with uh, the hypothalamus. Okay, hold on, I'm going to use a different program. That one's not working right. Let me do this screen share with you. Okay, the hypothalamus releases growth hormone releasing hormone, which goes to the anterior pituitary gland, which tells the anterior pituitary to release growth hormone. And growth hormone will go to tissue to promote growth. Okay, it goes to muscle, and that promotes increased protein synthesis. Okay, and it can go to adipose tissue to increase lipolysis, which means fat breakdown. Okay. All right, next, actually, let me pause for a second. Get my chat thing up here. Okay, did you see that? Alex, were you able to see me draw that out? Okay, great. Okay, next is we'll do follicle stimulating hormone and luteinizing hormone. Now remember, what we're doing for now is coming from the anterior pituitary, okay? So the hypothalamus releases gonadotropin releasing hormone, okay? So remember, the gonads, which is what that stands for, gonadotropin. The gonads in men are the testes, and the gonads in women are the ovaries. Okay, so the hypothalamus releases gonadotropin releasing hormone, which goes to the anterior pituitary to release follicle stimulating hormone and luteinizing hormone. Okay. Follicle stimulating hormone in men goes to the testes. In women goes to the ovaries. Okay, in the testes, specifically it goes to the Sertoli cells. And that activates spermatogenesis. Okay, which means the production of sperm cells. Okay, in women, it goes to the ovaries, and that helps develop the follicle, thus the word follicle stimulating hormone, so it helps develop the follicle. Okay. The luteinizing hormone part for men goes to the testes. Specifically to the Leydig cells. And that produces testosterone. Okay. And testosterone also influences spermatogenesis. Okay. In women, it goes to the ovaries, and it helps with ovulation. Okay, so these are examples of our formula, which is where is the hormone coming from? Where is the hormone going? And then what does it do? So what's the function of the hormone when it gets there? So that's what we're going to be doing with all these. Where is the hormone coming from? Where is the hormone going? And what does it do when it gets there? All right. Okay, next would be, let's do thyroid stimulating hormone. Okay, um, so we'll do that in prolactin. All right, so the hypothalamus releases thyroid releasing hormone, and that goes to the anterior pituitary, which tells that to release the thyroid stimulating hormone. Okay, so the answer is kind of in the word there. It's thyroid stimulating hormone. Well, what's going to be stimulated? Well, the thyroid. Okay. So the thyroid is going to release your T3 and T4. Okay, so T3 is the triiodothyronine. T4 is the thyroxine. Okay, and these go to most of the cells in the body. and the function is to increase your basal metabolic rate, which means it increases metabolism, also helps increase protein synthesis. Okay, hypothalamus releases prolactin releasing hormone, which goes to the anterior pituitary, tells it to release prolactin, okay, prolactin goes to the mammary glands in women, and this synthesizes the synthesis of milk production. Okay, so that would be for prolactin. Okay. Okay, next is the ACTH. Okay, so the hypothalamus releases corticotropic releasing hormone. Okay, corticotropic releasing hormone, which goes to the anterior pituitary, tells the anterior pituitary to release adrenocorticotropic hormone, which goes to the adrenal cortex to release cortisol, cortisol when cortisol is released, okay, if it goes to the liver, that increases glucose synthesis via glucose or gluconeogenesis. Okay. It also has an anti-inflammatory response and also suppresses the immune system. Okay. If it goes to muscle, okay, that is going to increase protein breakdown. And then if it goes to, or when it goes to adipose tissue, okay, that is going to increase lipolysis, okay, which is the breakdown of fat. Okay. All right, Alex, so far so good? Okay, good. All right. Okay, some other hormones. Um, let's do calcitonin. Okay, so the parafollicular cells in the thyroid, okay, release calcitonin. Okay, which goes to bone, and it tells bone to increase its calcium storage. Also helps decrease blood calcium levels. So if you eat a high calcium diet, lots of calcium in the blood, no problem. Calcitonin is released and puts calcium in bone. Okay, the parathyroid releases parathyroid hormone. It's when it goes to bone, it removes calcium from bone. Okay, and if that happens, this is going to increase blood calcium levels. So that being said, that means your body is currently experiencing hypocalcemia. Okay, hypocalcemia means not enough calcium in the blood. So your body goes, no problem, you're not going to eat it or whatever, I'll just get it from bone. So that's one way parathyroid hormone is released. Okay, if it goes to the kidneys, then it is going to produce or help produce the active form of vitamin D. Okay. Um, Give me one sec to look at some other hormones here. All right, I'm gonna do a screen share with you. Okay, so we're back on the hormone page. All right, so on some of these, we're just gonna um, cover it right here. Hold on a sec, bud. Okay. Um, so ADH. Well, let me go back to. So I'll do ADH and oxytocin. Okay. Um, so the posterior pituitary releases ADH and oxytocin. Okay, so the stimulus, okay, the stimulation is change in blood pressure. Okay, so that's important. The stimulation is a change in blood pressure, more specifically, a decrease in blood pressure. Okay, so that's important to know. Okay, this is detected, so the baroreceptors in the body okay, so the baroreceptors, which are found in the aorta and the carotid sinus, which are arteries in our body. Okay, there's nerve receptors in there. When they pick up on that, okay, they're going to tell the hypothalamus to release ADH, okay, from the posterior pituitary. All right, when ADH goes to the blood vessels, it tells the blood vessels to vasoconstrict, okay, which means it goes from a large diameter tube to a small tube. Okay, so it constricted, the tube got smaller. Okay, because it's a smaller tube, this increases peripheral resistance. Okay, and when you increase peripheral resistance, this makes the pump works harder. And the way we say that is increases the blood pressure. Okay. Now remember, what caused this is the person had a drop in blood pressure. Okay, so if the blood pressure is too low, that's not good. So the body can compensate, and in this case, it's doing it through vasoconstriction, which increases blood pressure. So within homeostasis, this is normal, this is good, this is fine. However, this can spin out of control and force a person to be in chronic high blood pressure over time, which is not good. Okay, oxytocin. All right, so that's let's see, yeah, posterior pituitary releases oxytocin, which goes to the uterus, and this is during pregnancy. Okay, and it's responsible for uterine muscle contraction during childbirth or during labor. And the muscle contraction is designed to help push the baby out. Okay. Let me go back to the Word document. Okay. All right, so from here, insulin is, it helps lower blood sugar levels. Okay, so it's released from the pancreas. Okay, more specifically, the beta cells. All right. Glucagon activates gluconeogenesis. Okay, released from the alpha cells. Okay, so estrogen and progesterone are released by the ovaries to aid in monthly cycles in women. Okay, we already did prolactin and testosterone. Okay, serotonin is released by the gut and brain, and it's a mood, appetite, hormone. so cortisol is for stress. We talked about that a little bit ago. Okay, melatonin is released from the pineal gland. And it's responsible for sleep. And it's activated by absence of sunlight. Okay, epinephrine, norepinephrine released by the adrenal medulla. Okay, to help with sympathetics, the sympathetic nervous system, also known as stress. Okay, and there's exercise, which is a form of stress, because it elevates your heart rate, dilates the bronchioles in the lungs, increases blood flow. And then there's the, we'll just say, unhealthy form of stress, just being pissed off and angry and all that other stuff. Okay, so when the body is stressed, it releases epinephrine, norepinephrine. Okay, atrial natriuretic peptide. Okay, that comes from, so if you think, all right, hold on. So the atria is in the heart. Okay, Na is sodium. So this is a hormone released from the heart that is going to do something with sodium. All right. Actually, I want to get back to that other screen, so give me a second to draw this one out. Okay. The atrial natriuretic peptide. Okay. The stimulus okay, the stimulation is going to be an increase in blood pressure. Okay. So in the heart, and here's the right side of the heart, here's the left side of the heart. Okay, that right atrium, okay, this side would be the left atrium, this would be the right ventricle, and that would be the left ventricle. So out of the right atrium, okay, it's going to release this atrial natriuretic hormone. You might also see it as atrial natriuretic peptide. Okay, but it is a hormone. And when it goes to the kidneys, it is going to increase urine production. Okay? Another way of saying this is it decreases urine concentration. Okay? So think about something that's very concentrated. So if I gave you, like concentrated Kool-Aid, all you have to do is add water. And if you add water, you're decreasing the concentration, okay, by increasing fluid. Okay, so increase urine production means you're decreasing the urine concentration. Okay, so when this happens, you're going to get a decrease in blood volume, which means you're going to get a decrease in blood pressure. All right, so remember, the stimulus is high blood pressure. So this is another method to help, or a method to help lower blood pressure by decreasing blood volume, which means you're decreasing blood pressure. Okay, so think about that. If you have a lot of volume in a tube, lots and lots and lots of fluid in a tube, that's a lot of pressure to push fluid through a tube. Because water is heavy, fluid is heavy, okay? So if you can reduce the amount of fluid in a tube, then you decrease the amount of pressure needed. Okay, so when the atrial natriuretic hormone or peptide is released, it will go to the blood vessels, okay, and it causes them to relax, which means they go from small to large. They're more relaxed. Okay, a big open tube is easier to push fluid through. It takes a lot of pressure to push fluid through a small tube. So the blood vessels relax, and when this happens, it causes a decrease in peripheral resistance. Okay, and that's another way of saying decreases blood pressure, or you could say decreases the load, the preload to the heart. Okay, so the heart doesn't have to work as hard. The pump does not have to work as hard. Okay. Okay, erythropoietin. So the stimulus is decreased oxygen. So erythropoietin goes to the bone marrow to spit out a bunch of red blood cells. And the more red blood cells you have, the better your oxygen carrying capacity. Okay. HCG is released from the placenta. And it helps to maintain pregnancy. Okay, the melanocyte stimulating hormone is released from the anterior pituitary, and it goes to skin, and it's responsible for, let's just say, skin darkening, such as having a tan. Okay, relaxin is released by the placenta. And it helps loosen up the joints, especially the hip, in the pregnant mom. So that child delivery is a little bit easier because the joints and the hip and all that are more relaxed. So that's where relaxin gets its name from. Okay, this one we'll draw out. This one's kind of complicated, so let's draw that one out on this other page. Okay, so this actually falls under the renin, angiotensin aldosterone mechanism. The renin angiotensin aldosterone mechanism. Okay, so the stimulation, okay, so the stimulation is a decrease in blood volume and a decrease in blood pressure. So that is what the person currently is experiencing. Now, when you hear this, meaning the stimulation is decreased blood volume and decreased blood pressure, you automatically know the goal is going to be do the opposite of this. So now the goal is to get the blood volume up and the blood pressure up. Okay. So like if the stimulus is you're really cold, well then the goal is to get warm. So we put a jacket on, we turn the heat on, that kind of thing. All right. Okay, so all right, so in the kidney, okay, it releases renin, okay, which is an enzyme. Okay. Now over here on the right side, we have the liver. Okay. It makes and releases angiotensinogen. Okay. It makes and releases angiotensinogen. Okay. In the presence of renin, it converts the angiotensin into, it converts the angiotensinogen okay, converts it into angiotensin 1, okay, which is a protein. Okay, angiotensin 1 goes to the lungs, okay, where it is converted into angiotensin 2. Okay, it does this from the, so it's converted by ACE, which is angiotensin converting enzyme. Okay, so angiotensin converting enzyme, or ACE, and this is why they give ACE inhibitors if the person needs it. Okay, so the ACE is considered a very powerful vasoconstrictor. Okay, now remember, the stimulus here is low blood volume, low blood pressure. Well, if you go from a big tube to a smaller tube, the smaller tube, which is vasoconstriction, the pump has to work harder to push fluid through a smaller tube. So therefore, it starts to increase the pressure. Okay, now angiotensin 2, okay, goes to the adrenal cortex. Okay, there's your adrenal gland. The outside part is the cortex. The inside part is the medulla. Okay, so it goes to the adrenal cortex and tells it to release aldosterone. Okay, and aldosterone, okay, remember, in the presence of aldosterone, you keep sodium and get rid of potassium. So by keeping sodium, okay, you're going to keep fluid. Okay, so these go together with this aldosterone package. So by keeping sodium and keeping fluid, you're going to also increase blood pressure and increase blood volume. Okay? So remember, with this stuff, kind of an easy way of looking at it, anytime you have a stimulus of low blood volume, low blood pressure, the goal is to now do the opposite. We got to increase the blood volume, increase the blood pressure. Just like if the stimulus is you're too cold, we got to get you warm. Okay? right. Okay, Alex, you still good? Okay.